The conversation you're about to enjoy took some turns I didn't expect. Of course, I understand the challenges around access to healthy and nutritious food, and we talk about this. But I was challenged to think about the ways historic policies and practices such as redlining manifest today in ways that further entrench marginalization. Now, that's a lot of words. So, what do I mean? Well, I mean that what we did in the past to keep down African Americans and segregate them into areas that struggled economically and didn't have easy access to good jobs, today appears as concentrated poverty, massive health disparities, and yes, limited access to fresh, nutritious foods. Now, I'm painting with a broad brush, intentionally, but the facts are clear. People of color have less access to healthy food, good quality health care, and quality education than do their white counterparts. We can argue then that food insecurity is not a contemporary phenomenon, but rather it's the product of generations of oppressive policies. This has given me pause to think, so maybe I'll do an entire episode on linking past injustices and oppression to current injustices and oppression. But that's for another day. One quick note about this episode. I have 4 guests. One joined us via phone from a remote spot in Maine, and we were thankful for that. But the audio may be a little wonky at times, and I hope this episode gets you thinking critically about America. Enjoy it. Hello and welcome to Fostering a Difference. Today we will talk about an issue that has impacted nearly 1 in 4 families in 2020, food insecurity. You might think that food insecurity is an artifact of the COVID-19 pandemic. However, according to data from the USDA, 13.7 million households experienced food insecurity at some point in 2019. That's over 10% of American households. And for a country with high agricultural output, this should be shocking to us all. And what's even more troubling for me and should be for all of us is that Black and Latinx families are even more likely to experience food insecurity than white families. This means that many children are not receiving the nutrition they need for healthy growth, development, and learning. And today's guests are truly making a difference. They work for Food Share South Carolina to ensure access to fresh produce for all people in and around the communities of the state. Food Share's mission is to, quote, good, healthy food for all. Joining us today are Michelle Troop, Director of Culinary Medicine, who's joining us from a kayak somewhere in Maine. Omesalma Rahimtula, who is the Director of Advocacy and Policy. Cindy Watson, social worker. And Courtney Watson, Community Outreach Coordinator. Thank you all for joining us, and we're looking forward to this conversation. I gave a little bit of insight a moment ago into the scale of this public health crisis, and I use crisis very intentionally because this is a crisis. But I would like for you all, if you can, to set the stage for our listeners to better understand not only what food insecurity is, but the scale and the scope of it. So if you could just talk a little bit about that for us, and then what is the impact here in South Carolina and then across the country?
I'll just start by maybe adding to what you were saying, and before we jump to the South Carolina specificities, to talk on a larger national, almost international scale about what food insecurity looks like. And I think that it's important, and that you said that Black and Brown families suffer from insecurity more than white families. So what that indicates, of course, is that this is a systemic issue, right? That food insecurity is not separate from other forms of injustice. And it's part of that, history of this country and how this country, I mean, if you think about it, was built on stolen land by stolen people. And what do we need for food is land and labor, right? So when we think of food insecurity, we can't disentangle it from that history of land and labor in this country and how injustices, low wages, lack of access to land, and health disparities are very much intertwined with questions of race and lack of access and justice. So just, I know, when we talk about food insecurity, we really do kind of boil it down to, food, boil it down to a perspective or an analysis that looks like it's isolated, but we always need to remember that it's not. And so I guess that's what I would add, or kind of not add, but contextualize to this conversation when we do dig deeper down into South Carolina, into very specific food issues.
Yeah, and thank you for that. I think it's certainly important for all of us to understand the systemic and historic nature of, again, this public health crisis, because a lot of us may think, oh, well, it's just, it may be a problem of lack of income, right? To afford nutritious foods, fresh fruits and vegetables, which we know are important, and we know tend to be more expensive. Or it's not just a matter of I can run to the local convenience store because it's more convenient than getting to the grocery store. So I appreciate that context, and part of the way I see this, and part of the conversation that I would like for us to have, is around the social justice piece, this equity piece, because it's not just ensuring that folks have a box of fresh fruits and vegetables every week. It's much more than that. So let's dive right into it. I mean, you opened the door to that conversation, so let's just jump right into it. Why is this more than just a box of fresh vegetables?
Yeah, I mean,
that's a great question. I think that this is Michelle here, I think that when you talk about it being more than just a box of fresh fruits and vegetables, it goes to that point of social justice. One of the things I say to our medical learners when I'm teaching about food insecurity is that food insecurity is the root cause for some of the poor health manifestations we see in the community, and also a manifestation of root causes that we see in terms of income inequality, historic redlining, or racial injustice, et cetera. And so a box of fresh fruits and vegetables is an open door to a world of ingredients that can be used for meals that are nourishing and fueling, that can lead to greater health outcomes when there's that support network around it. And I know others have much more to say about that from their different perspectives, but as far as our healthcare perspective, that's why it's more than just a box of food.
Yeah, and I think when we're going to, a large part of what I do is work with our rural communities to find folks who are already doing some sort of service to their community. So it's a nonprofit agency that wants to serve their community. We work with them to give them the tools to package a box of food, but often they're having to deal with a number of the other issues to make that effective. Because we know in Columbia that we have people in a generally dense location that they're probably going to find a way to us. But when you go out to some of our more rural communities, that's just not the same. And so they're having to really, in order to effectively create consistent food availability, they have to navigate their way through those other, root causes that Michelle is referencing, those other underlying conditions that create food insecurity. And I think we're really comfortable with the idea that food insecurity is a person that we see on the side of the road asking for money because they haven't eaten in a few days. But the reality is that food insecurity is so much bigger than that. That it's the family that's spending every dollar to pay their last medical expense or to pay for the car that's getting them to work, and so they're having to sacrifice food in some way because it's an expense that they're not being pressed to, to spend money on. When you have debtors calling or collectors calling for something, then you got to pay those folks. You don't necessarily have to go and buy groceries. And so food insecurity is at its heartbeat a lot more uncomfortable for us to face, that it's our next door neighbor who is making all the money that they need to make, but they're spending it in areas they just don't have a choice around. And so when we look at that USDA definition of food insecurity, that it's not only the lack of availability at a grocery store, but it's the lack of certainty around how you're going to purchase that next meal. I think that's the side that we're really trying to create a long-term solution, so that our families who are receiving SNAP benefits don't have to wonder how they're going to buy that next nutritious meal. They know they have a solution right around the corner from them. So I think that's a lot of kind of what you're asking about, these big things. But yeah, that's what we see.
And so I think to help the listeners, if you could repeat that USDA definition of food insecurity just to reinforce it. So we all know what we're talking about, it because it's not just, I wasn't able to buy food this day or a couple of days consecutively. It's much more than that. So if you could just throw that back out for us.
You're gonna put me on the spot to
I am.
The true definition, I don't want to try to say word for word, but in synopsis, in summary, it's the idea that you're lacking the appropriate availability of food when you go to your closest food retailer, and that your ability to pay for that next meal is insecure, which is not to be confused with a food desert, where there is a lacking of appropriate food sources in a geographical range, of which I'm not comfortable saying the exact terms, but I think those terms get really intermixed, that we're talking about the food insecurity of an individual or a family or a grouping of folks, and that they don't know where that next meal is coming from, where a food desert is a specific area where we know that there's, even if a family doesn't have food insecurity, they live in a food desert where there's just not available appropriate nutritionally balanced food.
So what is the scale of food insecurity in South Carolina?
And I think in a state like South Carolina that has a very long history of slavery and crop sharing, and like just lack of access to growing food, and just to securing income to be able to afford food, is more stark down here in the South than I think that you would find in more urbanized regions. So definitely that urban rural divide, and that just kind of long legacy of slavery.
Can you draw that connection for the listener between these historic contextual realities and what I might say are some of the modern day manifestations of that context? And again, you've talked a couple of times about the history of slavery, redlining, these sorts of, other sorts of historic economic barriers. So can you draw that or pull that thread through those arguments for us to understand why that matters to today? Because a listener might say, well, the federal government has SNAP, or a lot of people may still think of those as food stamps. So we're addressing this. Why bring up the past?
So I'll just give you maybe a quick example that is very, very recent. The the Agriculture Department, the USDA, just announced that they wanted to compensate Black farmers for land that was basically taken from under them. Through there's just like a history of Black farmers being marginalized from their land. And the Biden administration wanted to provide $4 billion, and it is going through in debt relief for minority farmers. But there's such a resistance from banks that the banks will kind of lose the debt collection, right, from those farmers. So it's just this wildly, I don't even like, I mean, I know that's not necessarily answering the question that you asked, but you can see that what that is the power of the rich, the power of the banks to really keep Black farmers in poverty. So if that's happening right now in 2021, imagine what that historically looked like.
We all know that nutrition is important. So talk to us a little bit about the impacts of food insecurity, on children, on adults. And I can think about a number of things with related to brain development and the like. But talk to us about why this is important because of the impact.
Yeah, food insecurity has been correlated with a number of poor health outcomes, both for children and adults. And it really comes down to food insecurity leads to malnutrition. So a lot of times we are confused when we see that obesity and diabetes, diseases we may relate to as being over nutritious, too much food in your diet, if you will, related to food insecurity or the scarcity. And it really comes down to what type of food you have access to.
We're nearing the end of our time, and I want to circle back around to the impact question. And y'all have intimated at several different points in our conversation today that this is much more than, to say what I said earlier, much more than ensuring people have a box of fresh fruits and vegetables. And so again, this podcast is more than just informing folks about issues, but inspiring and equipping listeners to make a difference. So talk to us about ways we can move the needle on food insecurity.
I think the number one way that we can move the needle, so to speak, is the Fight for 15 and other types of movements that fight for living minimum wage. This, as I mentioned, this is a structural issue, and it needs a structural solution. So just thinking big picture, in a state like South Carolina, we're still at what, 725? Can you imagine that that's what people live off of? And to further compound that, the state has a law that says municipalities and cities cannot raise the minimum wage, right? So the state is actively fighting against dignified living, right? On a more kind of macro food level, I would say definitely continuing programs like Healthy Bucks, which is really important. It's a SNAP incentive program to buy fresh fruits and vegetables. So as opposed to being paternalistic and telling SNAP recipients what they can and cannot buy on their SNAP cards, this provides an incentive to buy fresh fruits and vegetables. So if you spend $5 on fresh fruits and vegetables, you get an additional $10 to also spend on fresh fruits and vegetables, and a really important part of our program. So initiatives like that are also are really important. And then, I'll just plug there's a bill right now in our House to provide access for Black farmers, training programs, access to land. So programs like that that are, part of a reparations movement, I think are also super important. So there's lots of angles to it, I think.
I think some of us who are knowledge holders around the, empathy and compassion of food insecurity, having continued conversations with our friends, families, and neighbors about what it looks like to just hold less stigma of those who are receiving support for food, that it should be seen as a fundamental, basic right for folks, and it doesn't necessarily matter what that cost is to us.
Thanks for joining me today. And to those of you listening, thanks as well. Go out and make a difference.